weekdays noon to 3 on Tampa Bay Sports Radio. 620 WDAE and 95.3 FM.
Who's banged up? Who's in the training room? It's time for the Dr. Locke Sports Injury Report. In pain, don't operate. Rejuvenate. DrLocks.com.
Well, boy, do we got the right guy to talk about injuries today, and that is, of course, Dr. Dennis Locks, who joins us this time every afternoon or every morning on Thursday. Good morning, Dr. Locks. How are you?
Hey, Rick, how are you?
Doing well, and, we have nothing but speculation, Doctor, and I think you're the perfect person to do it.
I just love speculation.
I love it, of course. So we have no MRIs and even less information. But that being said, we do have a goaltender in Tampa Bay, Ben Bishop, who, for all the world, looks like he has some kind of lower body injury to deal with his legs. I would think a knee, perhaps a hamstring, something like that. Where he was able to play a full game, and now after a couple of days they decided not to play him. If it is a hamstring or something that's bothersome but not totally going to wipe him out, you care to speculate just on what might be going on and how long this may affect him?
Absolutely not. No. I watched some of the clips, and he's moving very gingerly.
Yes.
But you really can't pick up what it is, and the nature of hockey is, they hide these things.
That's right.
They don't want to tell you what their injuries are for good reasons. They don't want the guys getting banged up, but it could be almost anything. I mean, if it's a groin strain or a hamstring or even his knee, it's hard to pick up, and without knowing exactly what body part, it's really difficult to kind of make a prognosis for how he's going to do for the remaining of the series.
Yeah.
It's tough, but the fact that they sat him, it probably means, it's bothering him enough, and he was moving sort of slow the last game. But that's just the problem with hockey, is not knowing exactly what you got. It's kind of hard to pinpoint what you're going to be talking about.
Right. Dr. Locke's joining us here. Dr. JP here, we got a little more information on Desmond Jennings. Now after arthroscopic surgery and also, I guess, some exploratory surgery with the arthroscope on his left knee, he had a thickening of the tissue under his kneecap. They shaved that down now, and hopefully it's going to take him 8 weeks to get back. What can you tell me about this procedure? Should they have done exploratory surgery earlier to find out what was going on? What are your thoughts on this?
Well, when the synovium gets inflamed, they call it, generally it's a plica syndrome. Sometimes it's the undersurface of the kneecap, the cartilage there, they shave down. But this seems to be more like if he flew off to the Stedman Clinic in Colorado for another opinion, I think it's more indicative that the synovial lining had become inflamed, and it sort of folds back, and when it becomes inflamed, it thickens and becomes quite irritative, so that it hinders their play. So they end up just removing portions of it. That takes a few months to get back to top form, but it's not a major deal in that regard, in that usually they bounce back from it pretty quickly.
Yeah, so he wouldn't anticipate any kind of a loss of speed or strength once he rehabs that thing, right?
No, it's not a necessary functional tissue. It's actually the plica is a remnant from leftover fetal tissue that just doesn't do much in life, kind of like an appendix. So some people have it, some people don't, and so when the people that get it and it becomes inflamed, generally if they have it just surgically removed, they generally do well.
Hey, there's a Seattle Mariners slugger, Nelson Cruz, who, of course, leads the league in home runs. He left the game with back spasms. I think we've all had these at one point or another, and they feel debilitating at some level. What causes them, Doc, and how quickly can you get over something like that? How do you get over a back spasm?
Wow.
There's a lot of causes, right?
Well, that's a mouthful. That's long consultation in my office. Now, there are so many different potential etiologies for back spasm.
Okay.
Generally, what happens, and when you're taking a big swing, you're rotating and torquing across your spine.
Right.
And what that does is it can injure many different segments, but the most biomechanically sensitive area is the lining of the disc, which the outer lining of the disc is called the annulus fibrosus, and it's sort of woven like a basket, and so there's interconnecting fibers. So when you rotate and torque, it's put it under the most tension, and so some of those fibers can tear, and that's generally what your body does in reaction to that is clamp down and go into spasms to protect that segment. If it's a minor thing, just a couple of fibers, the spasms are generally self-limited a few days if you treat it conservatively with rest and ice and don't keep irritating it. If it's more extensive, more of the lining can tear, and then the disc inside can actually protrude or herniate out, and that's a bigger problem. So it all depends on the degree of the injury and how many, of these fibers, and if that's the actual etiology, which is the most common reason that people end up having back spasms, how long the duration of the injury lasts. But it can be anywhere from a couple of days if you treat it correctly with all the wizardry that the trainers have now to a much more lengthy problem if it's a larger disc.
And that Inside This Injury Report is brought to you by Dr. Locks' Sports and Regenerative Medicine. Want more information? Visit drlocks.com. In pain, don't operate. Rejuvenate. drlocks.com. Thanks so much, Doc. We appreciate the help.
Thank you.
Appreciate it. Have a great one.
We got some text coming in here. If the Rays win and nobody saw it in person or on TV, does it count? Yes, it counts.